and I just wanted to welcome everybody to our annual public and members meeting. Delighted that so many people have been able to join us today, and we've got a big team of presenters who are going to be involved in hopefully making this a really interesting meeting for all our guests to take part in. As this is a public meeting, I just wanted to confirm that we are recording the meeting, and that will enable everybody to, anybody who wishes to catch up on the meeting subsequently. And I know lots of people took that opportunity last year, so it's a great way of making sure everybody can catch up on our public meeting if they haven't had an opportunity to do that. As the slide indicates, I'm Krishni Waring and I'm chair of the Trust, so really pleased to be hosting this year's event yet again. And I just really want to make the point and apologise that we did in fact plan our annual meeting to take place a few weeks ago, but sadly, following the national period of mourning after Her Majesty's death, we did have to postpone the meeting that we had planned. So please accept our apologies for that, but I know you will understand the circumstances in which that was necessary. So here we are today, and as I say, really pleased to welcome you. As I think you all know, the annual meeting is our opportunity to reflect on the year that we've been through, and it's another unprecedented year in our NHS, and so we'll be telling you a bit about the year, and you'll be hearing a number of different elements of our annual report and accounts from different presenters who I'll be introducing along the way. Our theme for this year is compassion and kindness, and I think you'll recognise why that's incredibly important in these challenging times. But really looking forward to hearing and sharing with you some of the highlights of our year, albeit during these challenging times. We'll also be introducing our councillor governors and hearing a little bit about what they've been doing. They're an absolutely fantastic group of people who support us enormously in the work of the Trust and particularly the governance of the Trust. And as I say, you'll be seeing actually a great video that they've put together to tell you a bit about the work they've been doing on behalf of the Trust. And also delighted that, as you can see from the agenda, there'll be a couple of taster sessions, wellbeing taster sessions, which I think will really nicely break up our agenda and give you something else to think about. And again, you know, very important in this context of compassion and kindness to look after ourselves and each other. So I'll be looking forward to those sessions through the agenda. And finally, we'll have a question and answer session to make sure we've answered the questions that you've raised with us, either prior to the meeting or indeed during the meeting as it goes on. And we'll give you an opportunity to sort of add some questions along the way. So that's a brief overview of the agenda. Now, I think we're going to tell you a bit about Slido, which is a piece of kit, if I can call it that, that helps us to engage with you during the event. I'm going to try and explain it, but I'll bring Anne in if I struggle a bit. But you need to use your camera, which will hopefully recognise the QR code that's visible on screen at the moment. And that will take you to a place where you can hopefully record questions and things like that that you'd like us to answer. And is there anything else you wanted to add about that?
Not at all. That's perfectly explained, Krishni. The QR code will take your phone or your device through to Slido, or alternatively, you can go to slido.com and put the code in and it will take you through. And I think we have got an opening question for you in there, which I can bring that up now.
Thanks. So hopefully Anne's brought up the question, which if Anne's brought up the question for us, and if you've managed to get onto Slido, and I can see a number of people are doing that live, you can answer that question and you'll see people's contributions coming up and being shown on screen. And that's fantastic to see. So we'll just give people a chance to do that. I can see people are actually still recording their comments. Do remember that if you haven't been able to use it as a QR code, you can also go directly to slido.com. And as long as you use the code number that's shown on screen, you'll be able to access the poll. So brilliant. We can see from your contributions so far, in answer to the question, what does compassion mean to you? Most people have identified, responded with the word empathy. There's also a strong emphasis on kindness, understanding, and some great other, thoughts about listening, consideration, and being thoughtful and concerned for people. So hopefully that gives everyone a flavour of how the Slido facility works, and we'll be using that, as I say, through the meeting, which hopefully will give you a chance to feel like you're able to add questions and also engage with the content as we go through. So thank you very much, Anne, for taking us through that. Now, one obligatory piece of business that I need to do is we need to approve the minutes of our previous meeting, our meeting from last year. Those were available on our website, and if anyone has any comments on those minutes, they can leave them in Slido now. So there is an opportunity for us to note any questions or comments that you might have regarding those minutes. We'll just pause a moment to let that take place. But in essence, if there are no comments, then we will just accept the minutes from last year and move on. So I'll pause there. Anne, is there anything that you'd want to bring to our attention from Slido?
No, Krishna, there's nothing coming through at present on the minutes.
Okay, lovely. So we'll take that as accepted, and I think we can therefore move on. As I think I've already touched on, there's an opportunity for you to add your questions or comments to Slido generally as we go through, but please refrain from asking any or making any comments or questions about individual patients or cases that the Trust might be dealing with at the moment. For obvious reasons, we'd need to recognise confidentiality around those, but certainly anything to do with our annual report and accounts would be most welcome, and we will obviously pick those up where we can through the course of the session. So we're now going to move on to the actual opening section of our annual report and accounts, and I'm delighted to introduce Angela Hillary, who's our Chief Executive, and Angela will start this session by giving us some highlights from her perspective. Thank you, Angela.
Thank you, Krishni, and hello everybody. As Krishni said, my name is Angela Hillary and I'm the proud Chief Executive of Northamptonshire Healthcare NHS Foundation Trust. And I'm really pleased that you've joined us here today. So thank you for joining and participating with us. Now, as Krishni says, I've got an opportunity to share some key highlights, but it's really clear I can't share everything. So I would encourage you to read more in our annual report and accounts, because obviously that is where the lion's share of the information can be found. Next slide, please. Now, to demonstrate our core well-led focus, our vision and strategy are very much focused around compassion and kindness. And you will see that our vision is to be a leading provider of outstanding compassionate care. And we have here illustrated for you our 54321 roadmap, which is a series of elements that we use to link what we do together in NHFT on a daily basis. And that ranges from our vision, our values, our behaviours, our enablers, our strategy, and how we work together on the mission every day to make a difference for you, with you. So that gives us the essence of the bedrock of delivering that vision that I've illustrated. Next slide, please. Now, really important is to talk more than words. And what I wanted to share with you is some examples of how we illustrate and demonstrate our compassion in practice. And also to celebrate that, because it's our staff, our teams, our volunteers that really are delivering that across the organisation, and the achievements are only down to them. And it does help us to share with you publicly to validate the care that we're providing and the compassionate nature with which it's being delivered. And to give you some examples of that and the steps that we've taken to improve care and compassionate care across our populations, we are now an East Midlands lead provider for our child and adolescent mental health services across the East Midlands region. That's really important because it gives us an opportunity to improve care and deliver that across a regional footprint with our partners. We've also introduced electronic prescribing and medicines administration project, and I'm pleased to say that went live in some pilot wards in the Forest Centre at St Mary's Hospital. Again, a way in developing our care, making sure that we can reduce safety instances and to be clear and confident about the care that we're providing. I'm also pleased to say that we put forward Amelia Chitenthi, and she was selected and shortlisted to join the prestigious Developing Aspirate Black and Minority Ethnic Nursing and Midwifery Leaders programme. Really pleased, and I think we've seen through that work that Amelia's done that that's been making a real difference across the trust too. We also held, and you'll see in the photo there, a reflective event across the organisation. This was on the 27th of September. This one was at St Mary's Hospital. And it was a real opportunity to stop, pause and reflect across the organisation in the journey that we'd had through COVID from February 2020 right through to the arrival of the pandemic and the phases that we went through. A real opportunity to take time out together. We've also had a lot of help from our charities, the Northamptonshire charity this year, and the gardens that they've supported has really helped us. And one in particular, the Peace Garden at St Mary's Hospital, has been really important for time and space for staff, patients, volunteers, carers, people visiting to be able to go and spend time in that outside space at times of reflection. And I'm pleased to say they've also been able to brighten up the outdoor space for our children at John Greenwood Shipman Home and Centre too. We've also, through the year, welcomed new colleagues to join us across the organisation, and in particular we say that we've welcomed healthcare colleagues from Her Majesty's Prison Peterborough, and we've also embarked upon an international nurse programme and welcomed them to our organisation too. Krishni, as the chair of the organisation, also held a chairman's reception where we were able to celebrate and really take a really good thank you to all those staff that have celebrated more than 25 years in the NHS. You know, one member of staff, it was 40 years. It's an incredible achievement, and it's really important as an organisation we take time to celebrate that. And I'm pleased to say that the High Sheriff also visited us here at NHFT, and they were able to take part and participate, and really inspired the team at Her Majesty's Prisons and Young Offenders Institution at Swinford Hall. So again, thank you for taking the time out and spending some time with us. Next slide, please. Now, feedback is really important, and we as an organisation are clear that we listen to feedback. It takes many forms, and we continue to act and respond to feedback in those many forms. Now, you'll see it includes a range from service users, carers, teams, through the staff survey. And I'm pleased to say that we have already received very positive feedback from our junior doctors, and I'm pleased and very proud to say that we were in the top 5 for the junior doctors experience. That's a real accolade, it's a real credit to our staff who are supporting their experience, and of course that's the future for the NHS, so it's very important to be recognised in the top 5 overall. Now, over the next few slides, I just want to share some of the examples of where we are demonstrating our leadership behaviours in practice. These are really important to us, and I've mentioned that these are part of our connection, our 54321 roadmap. But through the next few slides, I'll just share with some of those examples of how we are using those every day as we go through what we're doing. Next slide, please. We co-produced our leadership behaviours, so they are really pivotal to us, and working together is clearly one of those. And what does this look like in real life is clearly an important question to ask ourselves. And there is no doubt, and Krishna has already mentioned, that the COVID pandemic this year as well as last year has really given us a chance to demonstrate this working together across the organisation and across our partnerships. And in addition to that, as well as managing that, which of course was very challenging indeed, we have, through partnership working, embedded mental health teams in 9 of our community locations. Really important, reaching to people, getting to the heart of those local areas which we know we want to improve our mental health response within. We've also worked very closely with primary care networks. These are groups of practices, GP practices working together across population groups. And I'm pleased to say that we have now worked with many of the primary care networks to develop Age Well teams, people who are supporting those people that need a neighbourhood response and can be supported in addition to what's being provided in hospital services and within our community services generally. And I'm pleased to say that we're supporting over 300 people, new people, every month in those services, which is fantastic achievement. Now, we're also using new technologies, and again, we know that through virtual monitoring, we've been able to step up the way in which we can monitor people through digital technologies, and we've also used a lot of digital technology in managing across the trust too. I think without the digital technology, it would be much more challenging to have encountered the COVID pandemic, and staff have really embraced that, and clearly we're taking that out into patient homes too, so that we can support the work of collaboratives across the county through integrated care. We also had a chance through our charities to ask our teams to come together in different ways in Reflect and Reconnect days. These were really important days, opportunities for teams to come together and really take some time out to think about how they can connect as teams and replenish and energise in what they had achieved, and really was appreciated across teams across the organisation. So thank everybody who's participated in those and to the charities for helping us to do that. In addition, there's a number of operational highlights I can't fail to mention. For those of you who don't know, we have a 24/7 mental health number, which is delivered in partnership with Mind, and it has responded to over 70,000 calls. It's really impressive. This has made a significant difference to people, and having that 24/7 access is clearly very, very pivotal indeed. We also opened up new estate, and I'm pleased to say in November 21 we opened up Lotus House as part of our community mental health offer, and we're looking to expand through our co-production not only the design that we took into that building, but also the services that we can offer through that town centre site. We also launched lots of new services, which again I've got many to talk to you about, but as I say, please have a look in the annual report for many more. But we were able to offer new support services through our mental health in schools teams, a really important national initiative that we've taken into local areas too. Maternal mental health continues to be a real focus for us as an organisation, and again supporting people who have had that birth experience where more support is needed has been a really pivotal amount of work going through this year, and pleased to say that recognition for that service continues to grow. Sexual health services have introduced text messaging for young people, again using different access opportunities. And immunisation was a very strong focus throughout the year. Of course, the COVID pandemic expected immunisations across all of the population, but our team of immunisation practitioners adapted to lots of new ways of working, and they vaccinated an additional 9,000 young people. That is about putting the population needs first, and I can only thank the staff that adapted and responded in that way. We've also partnered with new people to make a difference, and I'm really pleased to shine a spotlight on some of our sports partners, namely the Saints, Northampton Town Football Club and Northamptonshire County Cricket Club, who really risen to the challenge to help us support the mental health in our communities so that we can reach new communities and work together because of the profiles and the engagement and role modelling that they can demonstrate in action with us. So thank you very much for everybody who's helped us to do that. Working together is something we keep focused on and we will continue to do through coming years too. Next slide, please. Now, taking responsibility is another leadership behaviour, and you'll see through this slide that we have a real commitment, an absolute commitment to supporting diversity in the trust, and this goes with not only supporting diversity but also creating the inclusive culture that we feel is so important in compassionate care and our focus upon it. I'm pleased to say that we have seen improvements in both our Workforce Race Equality Standard and our Workforce Disability Equality Standard data. These are not quick fixes, but pleasing that we're now seeing differences in what we're doing, making a difference for our staff groups, and that can only be a good thing for our local population and what we do. Through that diversity and inclusion cultural work, we have now embedded fair recruitment ambassadors, because again, we know that that is a really important opportunity to strengthen recruitment across the organisation. And I'm really pleased to see that the equality impact assessment is strengthening across the organisation as we understand how health inequalities and the population needs to be represented in the work that we're doing. We will continue to do this throughout this next year. And of course, the integrated care system, of which we are a partner, will continue to stretch us all in delivering health inequalities for our populations. But you'll see there to the left on the screen that we have a very firm commitment to Together Against Racism. And this is some work that we've introduced with our group partner, Leicestershire Partnership NHS Trust. And we have a really clear and firm commitment to developing and maturing in this space, and there's lots of work going on in the organisation to demonstrate the culture that will really be Together Against Racism. And I'll just say thank you to everybody who is playing a role in delivering that across the whole organisation. Next slide, please. Now, being authentic was also something that was really important to our staff when we co-produced the leadership behaviours. So we are authentic is something that we challenge ourselves on and continue to strengthen upon as we move forward. And despite all of the pressures that people have heard about through the pandemic and the demand and increased pressures that staff had with new ways of working, I'm pleased to say that we still were able to focus across the organisation on health and well-being. And we used a lot of big conversations across the organisation virtually to get to the heart of what really mattered to staff. And through that co-production thread, we were able to understand what would make a difference to people. And we were able to put that into our whole recovery plan. And we developed a recovery plan that had 4 R's. We called them reflect, review, rethink and renew. And that was very much down through the big conversations and the feedback that we'd had from our staff. Now, I've mentioned already Reflect and Reconnect days, and I'm pleased to say that 83% of our workforce took time out to do that. I think it made a big difference, and we're doing it again this year as well because of the difference that it made. So health and well-being of our staff is very, very important, and we will continue to focus on it as an organisation. That makes a direct difference to the patient care that we can offer. Now, we also continue to use the feedback from our staff survey to understand what our focus on health and well-being is like for our staff, and we will continue to do that this year as well. And alongside that staff survey, we also take what we call quarterly pulse surveys to check, are we getting it right? Is there more we could do? How can we engage further with our staff to understand what's making a difference for them? And as part of that health and wellbeing offer, just to give you a sense of some of the things that we've done through that, we've increased the access to psychological support, and we've got health and wellbeing champions in the organisation. And importantly, we also took the lead role in providing access to psychological support for all staff across the health and care sector through our programme Stronger Together. And we know already that that has had a very good reception, and people that have used that service, the staff that have used that, have really been very complimentary indeed. We have a very strong staff network group across the organisation, different staff networks making a difference. This is where the staff voice comes through. This is where the culture work, the opportunity to stretch ourselves about an inclusive culture is so important, and our staff networks play a pivotal role in delivering that for us. We also believe very strongly in the organisation that everyone is a leader. So it doesn't matter what role you have, everyone is a leader and everyone can make a difference. So we hold a variety of different leadership matters opportunities where people can come together, virtual sessions, where they can hear about not least from each other, but also from world-class leaders about, through different masterclasses, about leadership and the opportunity to exchange ideas, which again is something that we know has been received very well through the staff group. And in addition to what I've described that, as I say, may not be happening in all of the trusts across the country, we continue to support through our occupational health services. We continue with our COVID and flu vaccination programmes for our staff. And of course, things like access to physiotherapy for those staff that need quick and speedy access to that support too. So many, many things, and we will continue to focus quite rightly in this area going forward. Next slide, please. Now, embracing change is again another leadership behaviour, and we know that change is absolutely continually expected of us, and really pleased that our staff chose to have this as one of our leadership behaviours. And the COVID pandemic was that in action, quite frankly. The fact that staff had to adapt, they had to work from home, people had to work in different areas. The fact that they adapted new technologies is embracing change, and we saw it in abundance across the organisation. And then in addition to that, I've mentioned the integrated care system. We have very much embarked on a very strong partnership journey through some collaborative working that is illustrated on the slide. Integrated care across Northamptonshire is focusing very much on our older population, supporting people across the pathway from acute care right through to their home environment. And we've very much taken a lead as a collaborative around the mental health, learning disability and autism sector. And I'm really pleased to say that that is being positively supported by our partners. So change will be the constant that we have, and we look forward to working with our partners to embrace the change that we expect in the coming year going forward as well. So next slide, please. So I think the final thing I wanted to say was a big thank you. It has been a year of compassion and kindness. As I said, there are many examples we could share with you tonight, but you know, for every touch point in the organisation, there is a story of compassion and kindness that has demonstrated us living our values in action. And I just want to say thank you to everybody. Every member of staff, every one of our volunteers, our governors, our carers, our involvees have made this happen. We have not achieved without you. Let us be clear. It has been a collective, combined effort, a focus on compassion and kindness, and it has been a joint effort all the way through. And I just want to say a special thanks, as I've mentioned already, our Northamptonshire Health Charity has really helped us through the year to focus on those extra bits that made a difference to our staff, and you can see some of those gardens there and some of the support that has been given. A big thanks and shout out to them from me and all of us for what you do in supporting us to make that difference. So thank you everybody, and I'll leave it there. Thank you, Krishni.
Thank you, Angela. That's a really great run through of some of the key things we've delivered and achieved on for our community and for our patients, and obviously with the superb support of everybody you've identified, for a great big thank you, which I think was absolutely right. So just a reminder before we move on that there's an opportunity, if there's anything that sparked a question for you, please do use Slido to record your questions. And quick reminder for people how to access Slido in case anybody's joined us perhaps a little bit late and missed the beginning.
Yes, if they go to slido.com and put the event code in 41079994, 41079994, then they can either put the any questions in that they've got as they go along.
Brilliant. Thank you, Anne. So please do put your questions in there, and we can look at those later and try and cover as many of those as possible when we come to that opportunity. I'm now delighted to introduce Thomas Finnegan, who is assistant psychologist. And Thomas is going to kick off our first wellbeing taster session this evening, which is all about mindfulness, I believe. So over to Thomas.
Thank you very much, Krishni, and hello everyone. So it's just going to be a very brief introduction into mindfulness. As Krishni said, my name is Thomas Finnegan. I'm an assistant psychologist with the IAP service. And again, it's hard to tell you everything about mindfulness in such a short space of time, but just to give you a brief overview. So with the next slide, I just want you all to take a few moments to just think about what your understanding of mindfulness is. You don't need to write it down anywhere, but just have a think what your current understanding is. It might be something that's completely new to you. It might be something that you've dipped your toes in, or it might be something that you actually know a lot about. But just have a think now, and then have a think a little bit later on if your understanding has changed at all. We have the next slide, please. So the primary focus with mindful meditation is generally the breathing, but the goal when we do mindful meditation is around having a calm, non-judgmental awareness, and this helps to allow thoughts and feelings to come and go without getting caught up in them. Because quite often we can find ourselves getting caught up in thoughts about the future, what might be coming up, what's on the agenda for tomorrow. We're actually thinking about what's already happened and maybe what we could have done differently. Mindfulness is just about being fully in the present, because your body is always here. So mindful meditation is just about helping you just bring your mind in line with that. Next slide, please. So in terms of what mindfulness is, really simply, it's just a way of seeing and interacting with the world around us. And research has shown that this does make us happier. And hopefully by the end of this kind of brief talk, you'll understand a little bit more about why mindfulness can help us to feel happier as well. Next slide, please. So in terms of mindfulness as a way of seeing and interacting with the world around us, one of the most important things is being present to what is going on, being open to our experiences, being curious about what's happening. And again, that non-judgmental awareness is really important because it allows us to fully enjoy what's going on around us. Again, research does show that being open, being curious to our experience without the need to judge our experience as either good or bad will help to increase our happiness, because we're able to fully focus on our experiences without the need to think it could be better or comparing it to other experiences. Next slide, please. So mindfulness is the way of interacting with the world by being present. And we practice this using mindful meditation. So mindfulness is that moment-to-moment awareness, whereas the meditation is a way that we can start to tap into this and practice this. So as I mentioned, generally, the primary focus is breath, without judging it, without comparing it. It's just about simply noticing it. And by practicing mindful meditation, actually makes it a little bit easier to be mindful throughout the day. So maybe you'll have a moment where you take a break from a meeting, you look out into the sky and think, oh, it's wonderful. It's nice to see the sun shining. Or maybe just taking that moment to appreciate what you're doing at the time, whether that's eating a meal, spending time with a friend. And when we are fully in the moment, it also means we're calmer and less reactive. And that allows us to respond in the way that maybe we want to respond. And on theme with kindness and compassion, when we are more mindful, when we are more present in the moment, it helps us to be more compassionate, not just towards others, also to ourselves as well. And it helps us to appreciate the little things that we can really often just discount. Again, that's the sort of feeling of the sun on the face, taste of a sandwich, the small gesture that someone does for you. But it just helps us to really tap in and appreciate those smaller things too. Next slide, please. So a quote from Mark Williams, who's a professor of clinical psychology at the Oxford Mindfulness Centre. And again, in terms of what being mindful is, it's just knowing directly what's going on inside and outside ourselves, moment by moment. So also being aware of any thoughts or feelings you have, as well as whatever's going on around you as well. Next slide, please. So again, it's about being aware of our thoughts, feelings, our bodily sensations, our surroundings, and being fully in the present moment without any judgment, but with an open curiosity of what is happening. And again, this idea that meditation is how we develop these skills so that we can apply them in our everyday lives as well as within the meditation as well. Next slide, please. So in terms of how mindfulness works, it's not only being aware of our external experience, but also allows us to become more aware of our thoughts and our feelings as we experience them. Because it can be really easy when we have a thought to get almost caught up in the stream and get washed away with it. And sometimes that might not be helpful, especially if it's an unpleasant thought, or maybe if it's an unpleasant emotion or feeling. So mindfulness helps us to take a step back from that. And it's almost standing on the side of a river, watching the thoughts and your feelings go by, rather than being washed downstream by them. So through meditation, we can begin to see thoughts as more of a string of thoughts or words or pictures that can be subject to distortion or error. Because if we see all of our thoughts as true and we hold on to them, that can lead us to experience kind of stress, whether that's, unhappiness or worry. And again, another quote from Mark Williams. This lets us stand back from our thoughts and start to see their patterns. Gradually, we can train ourselves to notice when our thoughts are taking over and realize that thoughts are simply mental events that do not have to control us. Next slide, please. So we're just going to do a brief meditation. There's a few things that we want to achieve with this. So first of all, it's an appreciation of the world around us, because often we stop engaging with what we're doing, we can settle into autopilot, and we're not fully engaged in what it is that we're doing at that time. It can help us to act in a more patient and thoughtful manner, as opposed to being reactive. And again, this isn't just with other people, but also with ourselves. It allows us to exist with the unpleasant, not be overwhelmed by it. And it also allows us to become more aware of our thoughts and emotions. So I'm just going to invite you all to close your eyes if you feel comfortable doing so. Getting comfortable wherever you are. And we're just going to start by having a look at what's going on inside your body right now. What's going on inside for you? Is your inner weather calm, sunny? Does it feel like thunder, lightning, or maybe chaotic? What thoughts are about. What feelings or emotions do you notice? Maybe you're worried and fretting about something coming up in the future. Maybe you're ruminating on an unhappy incident from your past. Are there any physical sensations in the body right now? We're not going to change anything. Instead, we're going to just be open to what's already here. So now narrowing the spotlight of your attention to the breath and how you feel it in your abdomen, in your belly. Tuning into the in-breath all the way as you feel it enter through your nose, indeed mouth. And follow the sensation of this in-breath. Be with it all the way to the abdomen as it becomes the out-breath. And then follow it back through the body, staying with this out-breath until it leaves your body. And if your mind wanders, and it will wander, always remember to smile and gently escort mind back to the breath as it flows in and out of your body. And not judging the breath in any way, not trying to change it, but just noticing it. Now expanding the focus of your awareness to take in the whole body, as if the whole body is now breathing. Being conscious of your posture, facial expression, whether you're holding any tension in your shoulders, your neck, maybe your back. Are there any sensations on the surface of your skin? Or maybe in your body, in your belly. But just holding all the sensations in your body in awareness. Just being aware of them as they are, not trying to change them in any way. And then your whole body rise and fall with the breath. If you become aware of any discomfort, tension, or resistance, just take your awareness there by breathing into them on the in-breath, and breathing out from those sensations, softening and opening on the out-breath. As best you can, bring this expanded awareness to the next moments of your day. Okay, well done, everyone. Hope you found that okay. You can always ask any questions later in the Q&A, but thank you for taking part in that. And if we could move on to the next slide now, please. So some of you might have noticed that your mind was wandering, you found it really hard to stay on track, and you might think that you were doing it wrong. But this is a really normal process in kind of mindfulness or meditation, because you're learning a new skill, especially if you're trying something you've never tried before. So actually that noticing that your mind has wandered and being able to bring it back is a really core part of being mindful, because it's all about being aware of your thoughts, being aware of your feelings, and then gently escorting your mind back. Next slide, please. So just a few little graphics to kind of finish off. Do you know why your dog is happier than you? So we'll look at this one first of all, and you can see the man, he's got a lot of stuff going on his head. He's thinking about work tomorrow, what he's going to wear, maybe any bills. He's got some songs stuck in his head. Where his dog is just at the park. It's noticing the trees, the sun, it's happy to be there. And if we look at the next slide now, please. Often people have this misunderstanding that meditation or mindfulness is having a clear mind and not thinking anything at all. And again, this is a really common misinterpretation, but what we're really looking to achieve with mindfulness, if we look at the next slide, please, is again just being fully present, just like the dog, being involved in the moment and appreciating it for what it is. Next slide, please. So as you can see, picture one, man's tangled in his regrets, is worried. When we feel depressed, or even if we feel low, stressed or anxious, we can spend a lot of time thinking about the past that we can't really change, a future that we can't really predict. So mindfulness is just about helping us stay in the present, fostering that curious and non-judgmental awareness, and really just being open to our own experience. Thank you very much. And that's all from me.
Thank you very much, Thomas. That was really enlightening and I think relaxing as well, dare I say. So thank you so much. And if anyone's got any questions for Thomas, as he mentioned, there's an opportunity to raise any questions through Slido, as we've said previously. So we'll leave that taster, wellbeing taster there. And as I say, invite you to submit any questions for Thomas, but we'll move on now to a video from our Council of Governors. I mentioned this earlier, and they play a key role in the Trust in supporting us do what we're trying to do and representing our community and helping us throughout some challenging times. So I'm really delighted to ask Anne to share the video that they have prepared in advance of this session.
My name is Chris Davison, and I'm the lead governor and also a public governor for Kettering and Corby. The NHFT Council of Governors are a committed and dedicated group of people with different life skills, experiences and knowledge. Together, we bring these views from the stakeholders and the communities we represent into the work of the Trust. We do have specific statutory, legal duties and roles, although they do not include the day-to-day running and management of the Trust. We represent patients, service users, carers, staff, partner organisations and the wider public. We have two specific legal duties. I like to describe them as two sides of the same coin. One is that we hold the non-executive directors to account individually and collectively for the performance of the board. So to that extent, we look into the NHS. Our other statutory duty, which is the same importance and the other side of the coin, is that we represent the interests of members, the wider community and members of the public. During the course of the video, you will hear from some of my colleague governors about the work undertaken by the Council during the year 2021-22.
Hello, I'm Joanne Dalrymple-Smith. I've been a staff governor for a year, and in my clinical role, I'm a specialist home enteral feeding dietitian. I would just like to share my experiences of being part of the Council of Governors. The pandemic forced the Council to undertake its duties virtually, resulting in everyone having to embrace working via Teams. Meeting times were changed to suit governors' availability and communicated via a calendar. This has led to a better attendance of governors, staff, and members of the public. The informal nature of the non-executive director and governor forum has helped strengthen relationships between us. Teams meetings have taken away the need to travel, which has reduced our carbon footprint. Council meetings in public are now recorded, so members of the public can watch them live or on demand as they wish. As a result of COVID-19, several new ways of working have developed. A staff side story was introduced into the agenda of the Council of Governors meetings. These stories bring an understanding to all of the staff governor's role and the challenges of working at the front line, and in some cases, sharing the patient's voice.
Hello, I'm Paul Kelly, and I've been a governor for the past 2.5 years and have successfully continued to work virtually throughout this challenging period. Virtually working with Joanne and the Single Point of Access stakeholder group provided a great opportunity to work alongside other staff members to identify innovative improvements to community services. Briefings and forums have been held to update us on the Trust's performance and plans, and to address our concerns and questions about mental health and community services. Attending Staff Care Quality Commission drop-in sessions has given us an opportunity to learn and listen and to understand the staff's honest insights and perspectives of the services they provide. Governor training and development has been adapted with NHS providers, core skills courses and workshops available to all, with more individually designed development courses to be provided.
Hello, I'm Carol Phillips and I'm Public Governor for Daventry and South Northants, and I chair the Governor's Nomination and Remuneration Committee, which acts on behalf of the Council of Governors and which plays an important part in leading the processes for the appointment, removal or reappointment of the Chair and Non-Exec Directors, or NEDs. We meet monthly and work as a team to fulfil the role of the committee. We set the terms and conditions, including pay, of the Chair and the NEDs, and we manage the annual Chair and NED appraisal process. In the last year, we've been really busy. We have reappointed a NED for a second term. We have reappointed the Deputy Chair. We have extended the term of the Trust Chair for a further year, and we have managed successfully the Chair and NED appraisal process. We have also recruited 3 new NEDs using a selection process involving the committee and other governors. These 3 new NEDs have all come with diverse experiences of the NHS. One from the commissioning side of the NHS, one with clinical experience, and one with little experience of the NHS, but with other expertise. They have all settled well into the role, and each one has brought their own previous experience to the working of the board. I think this demonstrates how important the responsibility of this committee is in the recruitment of NEDs and in the governance of the Trust.
Hello, I'm Helen Clark. I'm one of 3 public governors who are representing members and members of the public in Northampton. I was elected 2 years ago, and I've really enjoyed working with the Trust to find ways to improve representation. Representing the interests of members and the public is a core part of our role as governors. This is to make sure all our voices are heard and to help the Trust focus on the things which matter to our local communities. We are really well supported by the Trust. The management team have responded to our feedback from previous years, and they have invested in extra capacity in the corporate governance team, which helps us to perform our role and to develop our membership programme. This year, we've started a membership and representation group for governors. This group has given us the time and space to be able to work on our membership programme together. We also asked the Trust to help us to communicate with members more easily and effectively. In response to our feedback, the management team have invested in a new membership database. This new database will help us to keep member details up to date more easily. We've created a full programme for membership activity for 2022-23. This includes 7 webinar sessions on a wide range of different topics. We selected these topics from the feedback members shared with us on their interests. All the sessions are recorded, so you can watch live, on demand, and after the event. We look forward to welcoming you to one of our webinar events. Thank you.
I'm Councillor Matthew Golby and I'm a partner governor. So basically I'm appointed by West Northamptonshire Council, where I'm a cabinet member for adult social care and public health. And I think it's really important that we do have an input from partner governors, from other stakeholder areas of the health system within Northamptonshire, which adds a real level of transparency, openness, and shows that we're working together as a health system, which is really important.
About 18 months ago, I met with Peter Woollerscroft, the lead governor for Kettering General Hospital, together with Mabel Blades, the deputy lead governor, as we could see what was coming down the road with the then proposed integrated care systems for health and social care. As governors, we recognised that the NHS is changing, and we invited the chair and chief executive of the then proposed integrated care systems to 2 workshops, hosted one by Kettering General, one by NHFT, to discuss what our council's role might be in our future NHS and how best we could contribute to and shape the process of reform. Working through these 2 workshops in a very interactive, open way with question and answer sessions, with breakout rooms, it was held virtually, but nonetheless, it has enabled us as governors from both NHFT and KGH to develop and build on our mutual trust and understanding, together with enhancing our collective collaboration and partnership working. Along with Peter and Mabel, I was proud to present our joint work as an example of good practice at a national NHS Providers Conference held in July of this year. And I've also been pleased to support other trusts who are now considering how best they could work together across the East of England and wider field within their own integrated care systems locally. As volunteers, we give of ourselves, our time, our energy, and our enthusiasm because we care. We care about the NHS, we care about NHFT, the services it provides, and we care about our communities, irrespective of what constituency we represent.
Well, can I take the opportunity to thank our governors for the putting that video together for us, a really great and really simple explanation of the way in which our governors contribute, as Chris described, a very, very important role for the Trust in terms of governance, but also representation. So thank you to our governors who were involved in the video, but also to all the governors who played a really important role on our council. Without any further ado, I'll move us on now to the next section of our meeting today. And what I'm going to do is just ask Richard Wheeler, our Director of Finance, to talk to you about our financial accounts for the year 21-22. So, Richard.
Good evening. Thanks, Krishni. So I would like to remind people the full annual report and accounts are available on the Trust website. So please make those available and people can view them on there. The accounts are produced in line with government accounting principles and guidance. And again, during 21-22, it was a year when the pandemic did impact on our financial arrangements. Our income grew during the year by around 40 million, particularly reflected the Trust taking a lead role as a provider for regional CAMS collaborative services, also investment under the long-term plan in new mental health services, and particularly, as Angela mentioned earlier, community services supporting those people to age well across the county. Our costs did include additional spend related to the COVID pandemic, and also we invested significantly in facilities for our staff and to support our patients across the organisation. I would like to just jump to the next slide, please. So we're now operating under the ICS arrangements under the Health and Care Bill. The slide sets out some of the expectations, and I would like to take the opportunity to thank my colleagues for their hard work in delivery, staff across the Trust who've worked during the pandemic period and supported the financial arrangements, and my finance team for their support also. I'll hand over to Grant in a minute. Thank you.
Thank you, Richard, and thank you, Chair. I don't think many people will know me. My name's Grant Patterson. I'm the external auditor to the Trust, working for Grant Thornton, and I'm going to be joined today and a bit later on by Andy Reid, who is the senior manager on the audit. I'm the director on the audit, and what we're going to do now is briefly take you through the role of external audit in relation to the Trust. Can we go to the next slide, please? So I'm going to give a brief overview of the role of external audit, and then we are going to look back, because it's on 21-22, around the outcomes from our accounts audit, and then we'll also go on to the importance of the use of resources and value for money arrangements. We have the next slide, please. I'm sure some of you will be new to the role of external audit, so just briefly, what are our key objectives? You've heard from the governors. They appoint us as auditors, and therefore our role actually is to give them independent assurance, and the key to that is independent assurance to the Council of Governors on an opinion on the Trust's annual accounts. So that's a true and fair view of the value of assets and liabilities as at the end of March each year. And as you just heard from Richard, the financial performance of the Trust in that year. So that is our role, is to give a view on that and the true and fairness of those figures as presented to you. And then, being a public sector organisation, there's additional responsibilities on us as public sector auditors to give a commentary on the Trust arrangements for the use of resources, and that's more commonly, I suppose, for us known as the value for money commentary. And starting from last year and evolving to this year, that has got a lot more detailed under a code of audit practice from the NAO that we need to do. And you'll see a much more detailed report, hopefully on the Trust website this year, where we try to cover as part of that report the whole range of services that the Trust produces, and we do try and write that in plainer English. We also, as public sector auditors, have special reporting powers. So if we've identified any significant issues of concern, we can make references to NHS England. So that's, as the governors were pointing out, that's sort of looking towards the NHS. And we can produce reports in the public interest if we feel that there is a matter of such concern. I mean, just to put your minds at rest, we don't have any of those issues for this year. Could we have the next slide, please? So how do we perform that role? Well, the audit is generally an annual cycle in the September to December period. Really, we're beginning to sort of ramp up our planning, progress reports to the audit committees that we primarily report to on a sort of quarterly basis. And then early into the new year, or January to March, we begin our detailed audit plannings and the interims findings from work we do in that part of that. And then in the April to June period is the big, I suppose, remote, but generally on-site visit where we audit the annual financial statements and annual report. And then we report that and our audit findings reports, our ISA 260 report. And then currently, on the current arrangements, and from April to August, we produce our auditors annual report, the value for money commentary for going forward. Have the next slide, please. But you're probably more interested about who actually report to. So as I said earlier, audit committee is the one is within the trust governance structures, is who we have the most regular contact with. That considers our audit plan, our performance, and also we have to confirm our independence to that. We do also report to the board, because the board ultimately is responsible for approving the annual report and accounts. And the board is also responsible for making sure that any audit recommendations we made are acted upon, probably through the audit committee, and considers all areas of non-audit work. So if we do anything that's not the financial accounts audit. The Council of Governors, as I said earlier, does appoint and remove us as external auditors. And also, if we have significant issues to communicate with them, we will follow that through. And again, has a responsibility for approving any sort of non-audit work, again, sort of delegated through the audit committee. And then again, just as I was saying earlier, those responsibilities that we have are reporting to NHSE are around our ISA 260 report, our audit findings report. They also get copies of our report and value for money arrangements, and we have to report to them if there are any sort of referrals under various legislation or public interest reports. Can we have the next slide, please? So I'm just going to go on to planning, and then I'll hand over to Andy, who's going to take you through the findings. This is our first year for Grant Thornton as your external auditors. So we took over from KPMG, who audited last year's financial statements. We have spent that time getting to know you and its systems and management and finance teams throughout the year. And I would say thank you to Richard and to Fiona and to everybody else who's on this call for being open about their time and helping us to get to understand the way that you operate and to get to know you better. Our audit plan was issued back in March 2022, so to cover the 21-22 financial year. And as part of that, we identified as auditors significant audit risk areas around revenue recognition. That's the income the trust gets. There's something called management override of controls, and that's where we sort of have to assume as auditors be sceptical that if people wanted to manipulate the accounts in terms of show a much better picture generally, how could they do that? So we have to consider that as a risk. It's not, even if it's not necessarily saying it actually exists as a risk, but we have to assume it could happen. So we provide as audit around that. And then being the biggest sort of assets on your balance sheet, we specifically look at the valuation of land and buildings. And that all, I suppose, links into focusing around estimates and judgments in the accounts that could affect financial performance. So that's where we focus our audit work. What I'll now do then is hand over to Andy, who will just take you through what we found as part of this year's audit.
Thanks, Grant, and evening, everyone. As Grant says, my name is Andy Reid. I'm a senior manager with Grant Thornton, so I'm just going to feed back the results of our audit for 21-22, which, as Grant says, was our first year. So in terms of the outcome of the accounts audit, we presented and discussed our detailed findings to the board in May, but we're pleased to report there were no significant issues arising on the significant risk areas, and we were actually able to sign off the accounts with an unqualified opinion with no significant or material amendments having been made to the figures. So I think that's a very positive outcome in our first year as auditors. We reported in line with the NHS timescales, which again is something we'd obviously always aim to do, but we were able to achieve those timescales. I think the one area that we did spend quite a lot of time discussing with management and with the board was around some of the accounting estimates and judgments. As our first year, I think we came in and had some quite challenging discussions around some of the historic provisions that have been included in the accounts, so the basis on which they've been arrived at. Did a fair bit of work in that area, but ultimately we're able to satisfy ourselves that there were no material issues with those provisions. So again, happy to report that to the board, and that was reflected in our unqualified opinion. If I can have the next slide, please. So on value for money, as Grant has said, one of the other key areas of our responsibility as auditors in the public sector is to issue a value for money report. And that's actually captured in the auditor's annual report, which is a very detailed report. It's a public report, so will be available if anyone wants to have a more detailed look at what we said around value for money. The key finding there again is that we identified no significant weaknesses in the trust's arrangements for 21-22. So that is a very positive outcome. I mean, as auditors, we probably speak in slightly negative language here, no significant weaknesses, but that I think that was a very positive outcome. There's increasingly across the NHS a number of auditors are reporting issues and weaknesses in value for money arrangements, particularly on areas such as financial stability and governance. So there were no issues reported by us in our first year. We did raise some improvement recommendations, so if I could have the next slide, I can just touch on those briefly. And I think again the key thing to say here is these were really areas where we weren't so much criticising the trust arrangements, but just using our position as external auditors. We audit a large number of NHS bodies, and we're able to bring a bit of a fresh eye in our first year on some of the arrangements in place and provide recommendations where we felt improvements could be made. So I think the trust already had very strong arrangements in place, but this was very much around what could we draw to management's attention based on what we see at other trusts that could potentially improve things further. So there's 5 listed there. I think I won't go through them all in detail, but maybe just a couple to pull out. The governance one around linking operational risk to strategic objectives. I think particularly as the trust comes out of its response to COVID, there's been more of a refresh and relook at clarity around strategic objectives going forward. So I think what we'd highlighted there was maybe a need to just have a clearer link to the risk management around delivery of strategic objectives going forward. And also under economy, efficiency, effectiveness, I think already this evening there's been a lot of talk around partnerships, and this is an area that the trust is doing a lot of work in and a lot of developments around partnership arrangements. So one of the areas that we flagged there was maybe need to have a kind of a register to more clearly define what the partnership arrangements are that the trust has in place and how those are effectively managed and governed. If I could have the next slide, please. So yeah, just to really finish then in terms of our work for 21-22, as Grant says, it's an annual cycle. We've already started thinking about next year. We'll obviously be looking to build on the relationships that we've developed in the first year with board members, with governors, and with management. We did hold a debrief session for finance staff back in August just to start talking through how can we just make the process more effective going forward. What have we learned from our first year as auditors in terms of how we deliver the audit? And we're due to start a detailed planning process very soon. It's almost an all year round process these days, but come January we'll be getting into detailed planning again. So just to close, thanks again to governors and management for all the cooperation and support you've provided us in our first year as auditors, and I think that's all we want to say really. Thanks very much.
Thank you very much, Grant and Andy. I'll just mention that I think there's still perhaps a very short opportunity remaining for any final questions before we close the Slido for the evening, because obviously we will need to get through the things that we've already collected from you, and I think there's probably certainly been a few questions coming in, but I think important to say that as Grant and Andy have said, they're obviously part of our sort of external auditor, so a very important source of external assurance on the processes that the trust use in terms of financial controls and governance. So thank you again, and look forward to working with Grant and Andy in the years ahead. And thank you to Richard earlier, who is our Executive Director of Finance. Right, we now move on to our question and answer session. And I think what we've done, and Anne will confirm that I've got this right, we've collated the questions that we feel we're able to answer today, and they are shown on the slide there. So I think we've had some voting, have we, Anne, to indicate which questions people would like to see answered? Is that right?
We've had some voting. There's been also people on the call have commented on the excellent governor video and how relaxing and supportive they found Thomas's sessions. So yeah, so there's lots of comments in there. But I think the question that we've had at the top of the list is that people have been voting on is currently at the top of the list, Krishni.
Okay, so is that the only one? Oh, are there any plans? Is that the first one then?
Yes. Yeah.
Okay, so the first question we've got to address is, are there any plans in place to speed up the recruitment process when taking on new employees? So I'd like to bring in Chris Oakes, who's our Director for HR and OD. Chris?
Yeah, thank you, Krishni. Yes, we continually focus on reducing the time it takes to bring employees on board. I think it's useful to put a context in, though. There are a number of challenges with the time frame in that there are 6 NHS standards we need to meet to get DBS checks, right to work checks, occupational health, employment references and history, qualifications and identity checks. So they all need to be completed before someone can start. We currently have a KPI of 25 days for that, and in September we hit 18 days. So that's part of the continued focus we have on it. There are also external factors, because obviously people need to give their notice, and often they wait until the employment checks are done, and that's not in our control. And because of the employment challenges, a lot of trusts are increasing the notice periods, and often employers will choose to wait before they give their notice. But particularly in response to the challenges, we've got more ID appointments, so we make sure that we can, as quickly as possible, ensure people's documents checked, and also that we can link that to occupational health. And we constantly review the process to ensure that it's improved. So hopefully we can assure everyone that this is very high up our agenda, and we continue to focus on maintaining, pulling people in as quickly as possible.
Thank you, Chris. Are you also able to respond to the one relating to keeping and retaining our staff, please?
Yes, well, I think this is the other side of the coin, and this has become more and more of a priority, particularly with the labour market becoming increasingly competitive within Northampton, and particularly with all the distribution centres. So we've got a real focus on this. We have something called stay conversations. So when we understand someone's going to leave, the HR staff and managers want to talk to those employees to see what can be done to encourage them to stay. Is it about flexible working? What can we do? And we've reprioritised that, given it a ever bigger profile. Cost of living is also an important issue that we're all facing, and that hits staff. And we've got a cost of living group that involves the senior HR team and Richard, our Director of Finance. And we've done work on the mileage rates for staff. We've done things on discounted meals, and we continue to review what we can do to support staff. Because it's so important, we have been putting a lot of effort into a really detailed understanding of why people leave, what are the factors that cause them to leave. And in the current environment and some of the challenges there can be with work, one of the big things is flexibility, flexible working, work-life balance. So again, we've got a real focus on that and how we improve that to support staff, so that if people do want to work in different ways, we think about how we can change things to keep staff and make sure we really respond to that.
Thank you very much, Chris. So we've got a couple coming up now that relate to our voluntary and community organisations that we work with. I'll perhaps invite Richard Richard Wheeler to come in for the first one. Richard, are you comfortable to take that? In fact, both, if I could ask you to address both that are on the top of the list.
Thanks, Krishni. So yeah, I know we had a very detailed question, a couple of questions submitted beforehand, so it's very abbreviated. Apologies for that in the Slido poll. So the first one relates to work we're doing in mental health, learning disability and autism collaborative. We're really pleased that we're taking a key role in that, and people will be aware we signed a new longer term contract just in this financial year. That collaborative brings together a range of partners. It's built upon the voice of service users, and that forms the foundation of our outcome framework that we work through on that contract. That approach was supported by voluntary community and social enterprise sector, by service users and carers. And the aim there, the intention, to give people confidence is, we're looking to bring together health commissioning through a number of tranches. So we're taking services on in stages there to support delivering integrated care pathways. There was quite a lot of detail in the backing questions, so it may be appropriate. I'm more than happy to meet with representatives to work through some of the finer detail on that if people would find that helpful, and we'll make sure my contact details are available to do that. So I move on. There was a couple of questions about payments, so if I sort of take those together, and again, this was a more detailed question that came from a member of the Mental Health North Hants collaboration. So I recently signed a new five-year contract with the Mental Health North Hants collaboration. So I'd expect that would provide a greater structure to the financial arrangements, and ask to give confidence, want to work with the teams across the trust to support discharging our responsibilities in managing public funds appropriately. Obviously, as a foundation trust, we are responsible for complying with managing public money, which carries a high burden. There is tight financial governance and processes to ensure that payments are made correctly and appropriately. But if there are concerns, then we're happy to work through those and seek to address those. Thank you, Chair.
Thank you very much, Richard. So things are moving along. I think some of these questions are getting voted up the scheme. So the next one is, what are the board most proud of at NHFT? And I think, if I remember correctly, I think I might have agreed with this one. Was one that we had beforehand, and I might have agreed to respond to that myself. There's a lot to be proud of within NHFT, but I think probably what I would say, given all the challenges and of the last year or two in particular, I really would want to say thank you and say how proud I am of how our staff have risen to those challenges. At the end of the day, our vision for outstanding compassionate care is not something the board can personally deliver. We rely very much on our people to deliver it for us, and the way people have responded to those challenges have been absolutely fantastic. So I just want to say I'm very proud of our staff. I love meeting our staff on service visits and hearing what they've been doing. And I know as a board, the key thing for us is supporting our people to do the best they can for our patients and the community. So that's my personal response, really, and hopefully I think the board would echo that. Okay, the trust operates within a very challenged health and social care economy. How can it play its part in rising to these challenges? Angela, is that one that you can address?
Yeah, no, that's absolutely fine, Krishni. So I think a couple of things to say here. Importantly, it's critical that we recognise that we can't improve lives or care on our own. So being open to that partnership working is really important in the first instance. We've talked already about some of the collaboratives that are important. I think these are real opportunities to develop integrated care pathways to strengthen what's already being provided, so we can reduce duplication and make sure that the right person's getting the right care in the right place. So that's the opportunity that we want to take. It's also about, through the collaboratives, looking at the needs together, because again, when you look at it through an organisational lens, you may not see the whole person or all of those needs. So that opportunity is one that we want to take. And I think as part of that, if you like, responsiveness as a partner in that health and care system, it's important to keep learning and to be open to the changes that I've described. So that's what I'd say there, Krishni. Thank you.
Thank you very much, Angela. So the next one that's at the top of the pile at the moment is the integrated mental health triage through 111. And also a little bit there on A&E conveyancing and UEC. So I'd like to bring in Jean Knight, who's our Chief Operating Officer. Jean?
Thank you, Krishni. So yeah, we've heard quite a lot this evening about the Mental Health Integrated Response Hub. So that was opened in March 2020 and is actually a really fully produced, co-produced service, which we do in conjunction with colleagues in the voluntary sector. Around 60% of the calls into that are actually answered by colleagues through the triage process who do work in the voluntary sector. So I think it's a really good indication of how we are working together. We are currently taking calls from 111, and that, along with some of the other support that we've got in terms of crisis, such as the crisis cafes, crisis houses, are working in conjunction with the police around Alloy, is actually seeing about a 14% reduction in attendances for mental health patients into A&E, which I think is really positive. And there are some really exciting steps going forward, including mental health ambulance service as well, which will be done in conjunction with our partners in EMAS. So there's a lot of exciting things going on, Krishni, in terms of that. I can also answer the community equipment one, if that helps. So in terms of the community equipment returns, that's actually something that's run by our colleagues in social services. So I'm really happy to pick up and ask them that question, if that's all right, Krishni.
Thank you very much, Jean. That's really helpful. Okay, the next one is the one about the allied health professionals. So Linda, our Director of Nursing.
Thank you, Krishni. I'm pleased to answer this question because we do have a lot of allied health professionals in NHFT, and we value their contribution that they make to us delivering high quality, outstanding care. Our AHPs are utilizing the wealth of their skills and knowledge, and they make a very valuable contribution in the delivery of our services to our patients. Of note, we do have services that are led by our AHPs, for example, our MSK physiotherapy, podiatry, and even some of our other services in children's services where you have our dietitians and speech and language therapists who are at the forefront of leading those services. Our AHP workforce continues to grow, and with that, we have noted the inclusion of AHP colleagues from frontline services right through to senior management positions across the organizations, working right through in leading some of our transformation. So I am pleased to say that they're absolutely contributing and utilizing their valuable skills. Thank you.
Thank you very much, Linda. So we've got two, I think, final questions. The first one of which is the trust. How will the trust work as part of an integrated care system to improve care? David Williams, please, our Director of Strategy and Partnerships.
Thank you, Krishni. So I think we've already given some examples today of lots of different bits of integrated care and ways of working things through, Age Well, and all of the things that Angela touched on in her initial summary. But I think if we take the NHFT mission of making a difference for you, with you, integrated care is absolutely critical to that. So we know if we're going to deliver our mission correctly, we've got to do that by delivering integrated care. So you will find if you cut NHFT or integrated care meetings sort of through as a slice of rock, you would see NHFT in them. You'll see directors in integrated care meetings throughout the week. You'll see senior managers engaged, and actually you'll see team leaders and others working with social workers, the voluntary and community sector, and everybody to join up the pathways, break down the barriers. Probably a good example of some of the collaborative work and the work we've been doing with the voluntary and community sector for mental health, for learning disability, and also children and young people. So I think there's a lot of things in there of us working together. It's a real commitment from us.
Great, thank you, David. And our final question on the junior doctors' feedback is over to our medical director, Itai. Itai?
Good evening, everyone. I just wanted to say about junior doctors, one of the things that we've been working very hard to do is to create pathways for medical careers, as you can probably see from my backdrop. We believe that people start their medical careers as medical students, and we like to provide a culture for them to learn from more experienced clinicians, get a really rounded exposure to the services that we've got on offer. We pay a lot of attention to the feedback that they give us. We've got a very thriving Junior Doctors Forum, which expresses its concerns about how we are supporting them through their training. And what we try and do is be as responsive as possible to some of the concerns that they raise with us, because we know that the junior doctors will be the specialists and consultants of the future. So this is something that we will continue to work very hard on. We're not where we want to be. We feel that we can do better. We can get much more improved experience. And as we know that the medical student intake is increasing ever more, we'll have a job on our hands in order to try and ensure that we've got the same level of clinical and educational supervision that we currently provide. So we're working very hard to be ahead of the curve. We continue to, listen to our junior doctors, which is, I think, the main thing. When you listen to people and they give you, their perspective of how things are, you've got a better chance of responding more appropriately to their needs.
Brilliant. Thank you very much, Itai, and thank you to everybody. Well, first of all, those of you who submitted the questions, which are really great and prompted great responses, and thank you to all the executive directors who took part in responding to those. So without any further ado, I'm going to introduce our final wellbeing session, our taster session. Just to say, before we hand over to Dr. Sunil Ladd, who's going to lead us through that, if there are questions that we haven't been able to answer, we will pick those up after the event so that nothing will be lost. But really, thank you enormously for taking the trouble to raise them with us. So a final opportunity to think about our well-being before we close our event. So I'll hand over to Sunil.
Thank you, Krishni. Thank you, everyone. It's been a brilliant session so far. So I got invited to talk about compassion, and I'm really glad to hear the word several times this evening as well. And, a big value within NHFT and something that I'm really interested in as a psychologist to really understand the science of compassion. And I hope I'll give you a little taster of trying to understand compassion. We hear this word quite often all the time, but actually understanding its roots and how we can apply it is really important if we're going to apply it properly. Next slide, please. So I guess what we need to start off with is really understanding the brain and body that we've got, and that it's the result of millions of years of evolution. And as a result, when we think about health, we don't choose where we're born. That we've got a body that experiences emotions like anger, sadness, fear, joy, and lust, or even how many fingers and toes we're born with. So I guess, we're all kind of trying to navigate through life in many different ways, and our life experiences will be very different from everyone sitting in this virtual room tonight. And there will be experiences that we've all had which have shaped us in many different ways, as well as our own genes and genetics. And I guess as a healthcare practitioner, we also know that there are huge differences within the population, and what we're trying to do is improve people's lives in terms of their brains, in terms of their bodies, to get functioning in a really good way. So next slide, please, Anne. So I guess what we need to really understand is our brains. Our brains can be really tricky at times. So if we think about firstly our old brain, it's got, you know, it's parts of our brain which we share with other animals. It's got the ability to make sure that we avoid any kind of harm, make sure that we have food, make sure we reproduce, but also care and live in groups. That kind of triggers different emotions, whether that's anger, anxiety, sadness, or joy. And that triggers basic behaviors of fight, flight, shutdown, and caring. But we've also, what makes us quite unique as human beings is that we've got this new brain. And that new brain, and I think, you know, the mindfulness exercise earlier really helped us to recognize actually our new brain can make us plan, imagine, monitor all sorts of stuff. So you might be kind of thinking about what you might be eating later tonight. You might be thinking about your diary later in the week, or you might be thinking, oh gosh, how do I then practice compassion? So these things can have all sorts of loops. So if we bring on the next slide, please, we'll kind of think about how these loops affect us as human beings. So if we think about a zebra, for example, a zebra sees a lion, and what happens, it's kind of, its fight and flight system quickly comes on, which helps it to run away. As a result, it runs away, and let's say it successfully runs away, it just goes back to eating grass. And then hopefully its emotion will come down. It'll just go back to eating grass and it'll be okay. However, for us as human beings, we are slightly different because of this new brain that we've got. Imagine if a lion walked into wherever you are now. Let's say you successfully got away. Half an hour afterwards, you wouldn't go back to thinking about what you were doing, for example, making your dinner or anything like that. You'd be going back thinking, oh gosh, how did the lion get into my house? How did it get into my street? How did it get into my room? What if I would have been eaten? Who's going to care for my family? You'd be criticizing yourself if you were sitting next to the door. All of those kind of things. So we really need to understand this brain that we've got, which means that we kind of, it stops us from being compassionate because it kind of, our fear system keeps triggering in many different ways. Now, the good thing is that we live in societies where there aren't lions walking about, but actually we have a very different society now. So actually it could be an email that you get that triggers that lion. Yes, it's not a real lion, but it still trigger you in that same kind of way because our nervous systems are built in that way. So next slide, please. So we can kind of break down our emotions into three basic groups. So firstly, we've got our drive and excitement system. So that makes sure that we go to work, we do things, we achieve, and we generally feel good afterwards. Our next system is what is linked to our rest and digest. So it's when we're feeling good, let's say after you've had a nice meal, you'll generally feel quite good. But actually, this will only come on when everything is generally okay. It is safe to do so. However, the problem is that this final system will often get in the way. And that's our threat system, our threat and defend. And that triggers anxiety, anger, and a whole raft of emotions, which means that we kind of need to defend ourselves. We need to feel safe. So all of these different emotions have very different algorithms, and they will orientate our mind and our brains very differently. So next slide, please. So if we think about it, we've got the soothing system, which will really help us to trigger that kind of sense of compassion. It's when we really care. So it's when we kind of think about others, we're caring, and as a result, we'll be supported. So how does that work? So when that comes on, actually what that helps to do is that it calms our threat. So if something is happening, what compassion and a caring sense to, so someone, for example, supporting us, someone, you know, giving us warm love will help to really calm this threat system down. You know, that kind of, that fear, that panic. And that's what we do in our, you know, within NHFT, that's what we do when we care for our patients. If we can provide care, we will hopefully help someone when they're in that state of shock or fear or panic or whatever struggle they are going through. However, If that doesn't happen, and we don't have that caring other to support us, actually that calming can't happen. We do just then respond in many different ways, and that threat system will just keep coming on and on and on. And I think, you know, we talk about well-being. The reason we talk about well-being is that we need a break, because if we are constantly in that fight and flight, reacting in many different ways, which means that our ability to soothe goes out of the window. And within the trust, there'll be many different ways in which this can happen. And I think it's important, and that's why we talk about compassion, to invite the conversation. What are people's struggles? Create that safe space so we can identify what are the issues, because often when we're in that threat, we kind of make impulsive decisions. We don't react in the best way. So next slide, please. So what is the answer? The answer is compassion. And I think what I love about this particular picture is that we often talk about compassion, but it's kind of described as, oh, it's nice and caring, it's kindness, it's fluffy. Compassion is not fluffy. It's going to deep suffering. And that's why I love this example of the firefighter, because compassion is about going towards some huge difficulty. And we need that with courage. We need that with strength, and we need that full of wisdom. Because sometimes it's really hard to do that. So what are the qualities of compassion? It's about really caring for the well-being of yourself or someone else. And if we think about that example, when we go on a plane, you don't put on someone else's oxygen mask. You don't put it on them first, you put your own first. And I think that's really important for us as healthcare practitioners to really think about how do we firstly put on our own compassion in order to support those that we care for. So next slide, please. So there's many different attributes of compassion. So if we quickly flick through these are around sensitivity, providing sympathy, empathy, making sure we think about how to tolerate distress, being non-judgmental, and have a care for our well-being. And this needs to be done with warmth. It's really important. It's, for example, if you've got a child and you're telling them off, compassion isn't about not telling them off because it's, you know, they're going to cry. It's about saying, I'm telling you because there needs to be boundaries because I love you. So it's really important that we kind of think about compassion at the heart of it is around care, and we do that through warmth. So quickly, I know we've not got much time tonight, but I wanted to just invite a practice to think about, well, what does that look like? So again, you can do this with your eyes open or your eyes closed. And hopefully what I'd like you to imagine is someone in front of you. Now, this could be someone that you know or you don't know, but just start to see what image starts to appear. So this person in front of you cares for you, absolutely cares for you. But that person in front of you also recognizes that life can be full of suffering, can be full of hardship and all sorts of difficulties. Now, this person in front of you has got immense wisdom. They have been through this sense of suffering. They've learned the hard way. And as a result, they've got immense strength. Now, when they speak to you with their strength, with their care for you, with their wisdom, at times of difficulty, what word do you imagine they would say to you as a reminder? How do they portray that sense of compassion? And then just recognize, how does that make you feel? When you connect with them, whether it's a facial tone, eye contact, something that they've said to you, how does that make you feel? Do you feel that sense of warmth, that sense of compassion? Receiving that compassion, just notice what that feels like to receive that compassion, that care. Again, thinking about those words, wisdom, strength, and courage. So just notice, allow that feeling to settle within your body. Sometimes we do struggle in identifying that image, or we might question the image. I guess it's about that experience. The next slide, please, Anne. So I hope that was just a very quick taster of compassion. Obviously, if I could have a few hours, then we could spend a bit more time kind of really thinking about it, because it's not an easy subject. It can be quite tricky to understand it, to feel it, but I hope that that's given you a nice little taster of compassion. And yeah, thank you for your time. Handing back to you, Krishni.
Thank you, Sunil. Really thought-provoking as ever. And I think everybody would have really enjoyed hearing your reflections on that, and I think there's some learning for us there. Anne, did you want to, was there a question that we were going to ask in relation to Sunil's presentation?
There was indeed, but my computer just decided to say it wasn't working, so I've just had to very quickly reboot, and Slido's taking a little bit of a time to work, I'm afraid.
Okay, well, so we might have to perhaps park that for now, because I think we were going to sort of helpfully invite some comments and thoughts about Sunil's presentation, but and also yeah, some a particular question. So if it pops up, I'll let that go ahead, but otherwise I suspect we might want to move on, as I'm
the question is
in
I've opened the question in Slido, and we are getting some responses. So we're
Great.
getting warmth, everything will be okay, thoughtful, makes me feel calm. So the Slido technology is working. It's just my PC's decided it's had enough today.
It's perhaps had a little bit too much warmth then, and overheated a little. But there you are, excellent. Oh, it's really good to get a bit of feedback, and I'm sure Sunil will enjoy seeing that as well. And that warmth that Sunil, I think, emphasised on one of his slides is sort of coming through there really, and it really did strike me that how important that is to supporting people with compassion. Excellent. So keep those thoughts coming, and thank you so much, Sunil, and of course Thomas from earlier as well, because I think we particularly wanted to include those sessions because, you know, one of the things we really want to leave you with is the importance of kindness and compassion to each other, but also kindness and compassion to ourselves, because we do have our responsibility to ourselves as well. So can I take this opportunity to thank everybody again for joining us at our session today, looking back over the year, and you know, a challenging year in so many ways, but one which we also had a lot to be thankful for and a lot to celebrate. And thank you to everybody, all the presenters and our governors, as I said earlier, who helped us put that video together. We've now got an opportunity to get some feedback about the event, again using Slido. So if you'd like to share your views and thoughts on Slido about the event, and any words that might describe how you felt about the meeting today, please again feel free to share those. I think Anne is hopefully opening that up for people to comment on. And whilst we're doing that, I really just wanted to say thank you again to everybody for taking part, and just really encourage everyone to be focused on compassion and kindness as key things for the year ahead. So I've got nothing else that I particularly wanted to comment on, because I'm conscious we've run over a little bit over our planned time. And were you collecting feedback as part of the closing of the event?
Yeah, I've opened the feedback survey in Slido, which I can see colleagues are completing, and that will stay open for a few days.
Great. That's lovely. Well, thank you again, everybody. Thank you for fantastic presentations. Thank you for everybody's efforts. I think, through the course of a challenging year, as we've said, but much to be proud of. And obviously we're in, we're in another year, knee deep into another year. So, and certainly into winter ahead. Don't forget to get your flu vaccination, and for those who are obliged to or should also get a COVID vaccination, encourage you to do that, because these are really important things about being good and kind to ourselves as well. So encourage you to make sure you look after yourselves during a challenging winter period. But thank you again, everybody, for coming and taking part, and we'll see you next year, and we'll bring the event to a close.